back to the channel. Let's start. Yesterday we have dealt with all these. So we will dealing with warfare assessment today. Wall lines. Crown of impacted tooth, we have already know the classification, how it is mesoangular, distangular. Then we will deal with root of impacted tooth. Age consideration we have dealt in first class. And then we will deal with relationship with inferior alveolar canal. Okay, let's start with Warface assessment. Warface assessment by McGregor. W for Winter's classification, H for height of mandible, A for angulation of third molar, R for root shape, F for follicles, and E for path of exit. This is mnemonic for all these. Okay, Warface is the mnemonic. Now, the number denotes the difficulty in surgical removal of an impacted tooth. With 0, it is easiest to extract, and as number increases, difficulty in extracting the tooth increases. Warface has given his assessment based on this. He has scored the different types based on this, and then he has said that if it is 0, it is easy to extract, and if it is as the number increases, the difficulty index will increase. Let's see the score and how it is given. Okay, now Winter's classification. Category, the vertical impaction he has given score 2, horizontal 2, distoangular 1, and mesoangular 0. Okay, he has told that the most difficult extraction is vertical and horizontal, but practically distoangular is the most difficult extraction. Okay, now H for height of the mandible. If it is 1 to 30 mm, 0. If it is 31 to 34 mm, 1. And if it is 35 to 39 mm, the scoring is 2. Okay, then is A, angulation of third molar with second molar. If it is between 1 to 50, the score is 0. If 60 to 69, 1. 70 to 79, 2. 80 to 89, 3. And 90 plus is 4. Is the most difficult. Now root shape. If it is complex, 1. If it is favorable, 2. And if it is unfavorable, 3. Follicles. If it is normal, 0. If it is possibly enlarged, then 1. And if it is very enlarged, then the difficulty score is 2. Now path of exit. Space available. If there is a space, then the score is 0. If distal cusp is covered, then 1. If mesial cusp is covered, then 2. And both cusps are covered, then 3. These total scoring is 33. Okay. Now according to this and Peterson classification, we will define how difficult the index or the impaction is. Now coming to criteria and scale of Peterson scale. Okay. Now he has taken angulation, depth, and ramus relationship. Okay, if it is mesoangular, then he has given 1, horizontal 2, vertical 3, and distoangular 4. This is the difficulty index. Okay, he has considered the mesoangular the easiest to extract and distoangular the difficult to extract. Peterson scale. Now depth is ABC 1 to 3, and ramus relationship 1 to 3. Is 1 to 3. These two we have dealt the classification of McGregor. We have already learned that. Okay. If the scoring comes between 7 to 10, it's very difficult. If it is 5 to 6, it is moderately difficult. And if the scoring is 3 to 4, it is minimally difficult. Okay. This is all about Warface index. We have covered Warface index. Now we will be covering wall lines. Okay. Now coming to wall lines, it is mainly to assess position and depth of the impacted molar. Okay, W stand for white line, A stand for amber line, and R stand for red line. What are white lines? White lines, imaginary line got by joining the white enamel cusp of erupted tooth. Imaginary line joining the white enamel cusp of erupted tooth. This is the white line. Okay, what it indicates? It indicates axial inclination of impacted tooth. Okay, axial inclination of impacted tooth. Now coming to amber line, it represents the bone level distal to third molar. extended anterior along the crest of interdental septum between the molars. From where to where? The crest of interdental septum between the molars. It represents the summit of alveolar bone covering the impacted tooth, and it indicates extent of bone removal necessary during procedure. बोन लेवल रिप्रेजेंट करता है, कितना बोन निकालना है वो बताता है. और where is that amber line? This is between the along the crest of the interdental septum. This is the amber line. This is the amber line. Now coming to red line. Red line is a perpendicular drop from the white line to the point of application for an elevator. What is? It is a perpendicular drop from the white line to the point of application of an elevator. But it is measured in the amber line to the point of application. It is measured from the amber line, not from the red line, white line. Remember this. This line measures the depth of the third molar. What red line indicates? Depth of the third molar within the mandible. And if red line is 5 mm, extraction is difficult, and every additional mm increase in depth increases the difficulty 3 times. Okay, after 5 mm जितना भी additional increase होगा depth में difficulty 3 times increase होगी. So for mesioangular, this is the white line, this is the amber line, and this is it is a perpendicular drop to the point of application, but it is measured from the amber line. This is the point of application of an elevator, and this is the amber line, and the red line is this one. Okay, in distriangular, this is the red line. Okay, in horizontal, this is the red line, and in vertical, this is the red line. Hope I am clear with word lines also. Okay, now coming to root part. Root of impacted tooth. It can be fused or separated. It can be single or multiple. It can be straight or curved. It can be favorable or unfavorable. What does this mean? Favorable means root followed the expected line of withdrawal. But in unfavorable, it opposed the expected line of withdrawal. Convergent or divergent. Long and slender or short and stout. Okay, these are the root of impacted tooth. These are how root can be. And now coming to the last, the root and Sehab radiographic criteria. We have learned that we will see the relationship with inferior alveolar canal. So roots and Sehab have given this criteria. Okay, it is divided into A, B, C, D, E, F, G. Okay, A is darkening of root. B is deflection of root. C is narrowing of root. D is dark and bifid apex of root. Now E is interruption of white line of canal. Okay, from A to D, it is all about root of the mandibular molar, and from EFG, it is about the canal. Okay, if there is interruption of white line of canal, this line has been interrupted, mainly in horizontal cases, then it is E. Then diversion of canal, we can see this is a diversion of canal, and then last is narrowing of canal. This is narrowing. Here the canal is broader and now it has become narrower. This is narrowing of canal. Okay, now we have completed this. This is all for today. In next class we will dealing the surgical procedure. Till then, like, share and subscribe. Bye.